All right, and we're live. That's right. Dr. Kris is in the house. It's a beautiful day in Texas. How are you doing, Dr. Kris?
Great. It's not even like insanely hot today. Low 90s. We can take that in, this time of the year in August. So not too bad.
For sure. It's been really hot here lately, but seems like we've gotten some rain. Things have cooled down. And
Labor Day is always kind of that marker for I think we're going to survive the summer. So it can be sad in one way because kids are all back in school. I know they don't like Labor Day for that reason, but I like it because it means it's about probably to have a nice little month or so of decent weather.
All right. Well, let's roll the intro. If you're like most folks Dr. Kris Fusterhausen works with, you're active, you want to take ownership of your health, and you want to age gracefully. The problem is there is so much conflicting information out there about health and wellness, it's tough to know who to trust. Most providers are limited by what insurance will approve, so it can seem like they're only able to help you manage your health decline with more meds. On the Dr. Kris Life Podcast, you'll learn how you can regain your confidence in your health journey. You'll learn helpful knowledge about programs, supplements, peptides, and hormones that Dr. Kris has used with thousands of patients just like you to help them crush their goals and be their best selves. So if you're ready to take charge of your health and are wanting to stay active and healthy so you can be a better parent, partner, or lover, then you're in the right place. Welcome to the Dr. Kris Podcast. Dr. Kris, lots of conversation going on about inflation in the political realm, but today we're going to talk about inflammation.
I still want to go back to what are they doing in that bathtub? Anyway, I just never can get over those two people drinking wine in a bathtub. Of all places to pick to choose it, they're not in water; they're just in a robe sitting in a bathtub. But anyway, I'll let it go.
Yeah, I always notice that, and I was going, "What are they? Would they put the background of water in there?" That was.
Yeah, what was the ultimate plan there? I don't guess I've ever been in love enough to want to sit in a robe with drinking wine in a dry bathtub. But whatever. Right. To each their own, everybody's into their own thing.
Yeah, we're not judging.
Yeah, we're not judging. Well, we are judging, but that's okay. It's a mild judge. My nurse practitioner has a saying that I always like that I think is hilarious. She's like, if you can help it, we can tease about it. If you can't help it, we can't laugh about it. So they could help being in a bathtub in robes with wine. So I can make fun of it. But yeah, inflammation. Actually, I want to start this off with, and I'm not trying to get political at all, but RFK Jr., ceased his political candidacy on Friday and, has, I guess, somewhat sent his approval to Trump. But the reason I brung that up is that he did a really nice talk about food. And, one of his big platforms is food in America and how inflammatory food in America is. And one of his big stances is he believes that government needs to get involved with our food. And I would say government right now is involved in our food, and that's probably part of the big problem. But I agree with his stance that many of the ingredients that we consume in America are actually are deemed carcinogenic, cancer-causing in other countries, and are actually banned. We have to realize that in America, we can't rely on our government to show us how to eat. The old food pyramid is a very flawed thinking for how to eat. And I always try to keep things simple, as you and I talk about, and I joke, but I typically say very few healthy things come in a bag or a box. And we just need to think about that, inflammatory foods and what they do to the body and inflammation. One of the things we tout on this podcast and we tout in our clinic is inflammation drives being unhealthy. And inflammation typically starts with our diet. Inflammation starts in our gut, and our gut is the root cause of Inflammation and gut health are the root cause of most of our health issues. And if we can, that old saying, we are what we eat, I think there's some lot of truth to that. We are what we eat. And if we eat good, it's amazing how most people feel pretty good if they truly eat well, or if they eat poorly, they don't feel good. And I just think that so many people, so many even doctors, providers, NPs, and PAs may not understand what is good food for our patients. So anyway, I just want to throw that little political, non-political statement in about, I thought that was oh, by the way, that he was getting, I'm not going to name the news entity, but he was getting blasted about it, saying that here's this non-doctor, he doesn't know what he's talking about, when yeah, he really does know what he's talking about the food that we're consuming being bad for us. But anyway, little side topic there.
Yes, the other day I was watching this guy show how to start a fire and cook just a hamburger patty in this little clay pot with just 3 charcoal briquettes. But do you know how he started those 3 charcoal briquettes?
How?
He took a bag of Dorito, nacho Dorito. He took a couple of them out, lit it on fire, and that Dorito burned enough to start those cold briquettes.
So you can use Doritos as a fire starter, basically.
Yeah, but think of all the chemicals in there that allows it to burn so long.
Yeah, as I was telling a patient,
in your gut.
Yeah, what I was telling a patient this morning is, I'm not debating that those foods taste good. I'm not going to lie. I like some nacho cheese Doritos. But when you think about that coating that gets all over your fingers and turns everything all these colors whenever you touch them, or something that can stay in a bag for years and you can open it and it still's good, like it still tastes fine, it's still crunchy. That's not the way normal food is supposed to be. Things are supposed to expire for a reason. We're even seeing now fruits and vegetables that stay like ripe for really long periods of time. That's not normal. Like, what chemicals were put on that in order to do that? No, that's a great example. I love that you brung that up. A Dorito that I can catch on fire and start my charcoal, but is okay for my gut. Yeah, like you said, what kind of inflammation is that causing in my gut, right? So. Yeah, absolutely. One of the great places people can start is getting back to just whole, good foods. A lot of times I think people pay a lot of money for things that I don't necessarily know is really worth their money. But, one place you can start is organic. And I like trying to tell people, find your, like, you don't always know, but if, like, we live out in the country and there's actually people that grow the food and on their land, and they have like a little stand on the side of the road, like stopping there and buying your vegetables. Mm-hmm. And generally, if Farmer Joe tells me he's using no pesticides and things like that on his garden, I don't have proof, but I somewhat believe that. I'm always the guy that's like, how do I really know that what I'm buying from this big grocery store chain really was raised in the way that they claim it was? Mm-hmm. I don't really know. I mean, I'm on the back, and again, you and I both know this is not a political show, but now I'm back to trusting my government that they actually did inspect these people and all these rules were followed. I tend to believe Farmer Joe on the side of the road more than I do Big Pharma, and so. Those are some things I tell patients, eat food that has color when it's a vegetable. Try to buy from local places because most of us don't have the time to, grow it ourselves. Cook it correctly, grill, bake, broil it. If you are going to sear it, do it in extra virgin olive oil or avocado oil. Stay away from all those nasty oils that are causing us so many problems today. But the issue still comes back to, we can be as good as we want to be, but we still end up in fast food lines or we end up in restaurants, right? Like, unless you are like live in a box, and I'm not making fun of that, but we all eat in restaurants and fast food restaurants on occasion. If you tell me you don't, I'm not buying it. We just do. And now we're back to the quality of the foods. We're back to the oils that they're cooked in. We're back to just overall quality. So that's where sometimes we have to do other things in order to try to augment that. And then, so we talked about diet for a split second, stress. I don't know about you, Steve, but I'm stressed. I talked to you about one of my stressors from last week. With Leonard, who's been on this podcast, Lexi Yu hasn't been on my podcast, but I've been on her podcast. We put this training course together. It had it was amazingly well received. But now that that's over, my stress levels have come down a little bit. But something's going to pop up in the next week or two that we're going to start ramping up for, cortisol levels start going crazy and all these sorts of things. Man, if you're a businessman or woman in this world we call America today, you're stressed. I don't care. You can tell me that unless you're so successful, you're at the phase to where somebody else runs it for you and you just get the money dumped in your banking account every now and then and you live on an island, you're stressed. As I tell my patients, you can have the best business in town and you're stressed trying to keep it there. You can have the worst business in town. You're stressed because you're trying to make it better. Stress is stress. Your body can't tell good stress from bad stress. It just knows you're not eating right. You're not sleeping right. You're not exercising appropriately because you're stressed. And I know we've talked about this before, but we talk about how testosterone and growth hormone do the things in our body we want them to do. They're anabolic to muscle, meaning they make muscle grow. They're catabolic to fat, meaning they break down fat. What is the one hormone that does exactly the opposite? Catabolic to muscle, breaks it down. Anabolic to fat, makes grow fat. Cortisol. What do we release when we're stressed? Cortisol. And so, it's just one of the things we really pressed to our providers when we were teaching them on Friday is like, the stress, like these patients that come in and they're like, man, and by the way, what does a bad gut look like? What does inflammation look like? It can look differently for everybody. For one person, it may be acne, red in the face. It can mean bloating. For the next guy or girl, it's like, hey, I'm doing everything right, but I can't lose weight. Maybe I am on semaglutide or tirzepatide, but I'm just not losing weight. To another person, it can be lack of sleep and, I'm just restless or I'm anxious. Inflammation can be, believe it or not, the cause of all of that stuff and many, many more things that you and I don't have the time to talk about in a 30, 40-minute podcast. And where does that inflammation come from? That comes from the gut. Where does the gut dysfunction come from? It comes from diet, stress, lack of hormones, all of those things, poor sleep. So it's this vicious circular pattern. The poor sleep causes stress. The stress causes poor sleep. And, by the way, we're not going to come to an answer to this vicious cycle at the end of this podcast. We're just trying to talk in ways to maybe help with it a little bit and maybe give, one really good little thing that I find that helps a lot. But that may be a little too long, but it's just this treadmill, this vicious treadmill that I feel like, or maybe the hamster wheel might be the better term that I think we all live in. I think you do. I know I do. And we try to minimize it the best we can, but it's tough. It really is tough. Minimizing stress is a difficult thing to do.
Yeah, that I study this stuff, and there's a connection between your gut and your mind, your brain, and it's amazing how important the gut is. And I try to take probiotics and prebiotics, and I try to focus on that. But it's always my stomach makes these noises. I have a sensitive stomach, and it can ruin your day.
Yeah. And I try to tell patients, like, how do you know you have poor gut health? And these are the questions that generally people don't like to answer, but you talk about bowel movements, okay? And it's like, are you constipated? Do you have diarrhea? Are they too loose? Are they too hard? Do you go every day? Do you go 1 to 2 times a day? What does the color look like? All of these different things. And you'll be amazed at how few people have normal, soft bowel movements 1 to 2 times a day. Many women kind of live on the side of constipation. Like, I'm blown away when people say, yeah, I go once every 5 days. Like, oh, Jesus. Or the person's like, yeah, I go 7 times a day. Yeah, and it's really, really on the more watery side. And I'm like, these are all signs of poor gut health. Mm-hmm. And, there's really complex ways to go into the gut, which really is too deep for something like this. But there's also simple things people can do that, like I always say, some things you can do and you don't even have to go see a doctor, and you can try it. And they, best case scenario, they're not going to hurt you, or worst case scenario, rather, it's not going to hurt you. At best case scenario, it dramatically changes some things. So, but I think there are very, very few Americans that actually, who aren't trying to have good gut health, that actually have good gut health, at least adults. And actually, I would say teenagers and up. And people just accept it, that that's normal. They don't really think about it. It's kind of gross. People don't like to talk about it. They don't like to go into a doctor. Doctors don't like to ask about it, and patients don't like to talk about it. Like, tell me about your bowel movements. That's not actually the way to start a conversation that most people are happy about.
Yeah, the last time I had a colonoscopy, the doctor came to check on me afterwards, and I said, "Hey, why my stomach just makes all these noises all the time?" And he said, "It's normal, but I don't think it is. It didn't used to all these noises all the time, and it's like it's annoying to me." And so I know where the conversation we talked about before, where it's going to go, but I just want to tell you, Dr. Kris, that when I started taking these gut tights, and this is your BPC 157 plus a KPV, my stomach calmed down, and every once in a while I'll run out. And I can sense a difference in my stomach. And I never could find something that calmed it down. And it's not an antacid. It's not anything like that whatsoever. But I was like, it's made a big difference for me.
So let's go back, and I think you made a statement that I find to be great. And by the way, one of my best friends is a GI doctor, and he's, in my opinion, one of those GI doctors really doing it right. And I'm sure there's a lot of GI doctors doing it right. But I want to go back to your conversation you had with your GI doctor. Basically, what your GI doctor was saying was, I did a colonoscopy, it looked normal.
Mm-hmm.
Anything past this conversation is going to turn into this long, drawn out conversation that I don't really have the answers for, because even most GI doctors I talk to, they don't know about BPC, they don't know about KPV, things like that. And I find that it's kind of one of those topics as traditional medicine doctors. Hey, my stomach makes a bunch of noises, or hey, doctor, I've gained a couple pounds, or hey, I think my hormones are off, that we kind of get figuratively patted on the head and told everything is okay. Now go on, young man. When actually it's not, right? And we're smart enough to know that it's not. And that's why many times providers, I think, like to align with more functional thinking practitioners, right? So that they can actually do things a little bit differently, do things a little bit better. And you mentioned gut tides. So what is gut tides? Gut tides is a combination of two peptides one's called BPC 157. BPC is made in our gastric juices of our stomach. We'll talk a little more about what it does. And KPV is a tripeptide. It's just a 3 amino acid peptide. And that combination is oral. It's over the counter. You don't have to be my patient to get it. It's on our website. I've never seen any side effects with BPC and KPV. That's the great thing. That's why I say, besides spending some money, I don't believe there's any true risk in trying BPC, KPV. I have no contraindications. Like when patients say, who can take it? I say, well, everybody. All adults can take it. And it's oral. That's the other nice thing, is so many of the peptides that we talk about are injectable, and they require doctor's visits and they require blood work. And so BPC KPV is one of those things that you can take one a day, and it can actually do you some good. The nice thing is it's over the counter. The nice thing is it is oral. So it kind of fits all those things that our patients typically like, because not everybody likes injecting things. Not everybody likes coming to see the doctor. And if we want, we can talk a little more in depth about what they do, but yeah, it can be a very, very good thing. And so it's personally in my practice where I always start with gut health. And a lot of the practitioners I train with do the same.
Yeah, it's amazing. The gut brain connection, the things that I kind of learned about on that is that BPC stands for body protective compound.
Complex, yeah. Uh-huh.
And it's like it's working on your brain. It's helping your eyesight. There's a lot of things going on that
Yeah,
BPC?
so let's cover that real quick. So BPC, I always tell patients, does three major things in the body. It's amazing for gut health. It can decrease acid production. It can actually heal ulcers in the stomach. It can help patients get off those proton pump inhibitors that so many people take, like Prevacid or Prilosec, those type of things. And a lot of times people, they will take PPIs and then, they really shouldn't be used long term. PPIs, they have some long term consequences. And when you come off them right away, though, your acid production comes right back, it rebounds. And so patients start to feel their reflux again and they immediately go back on it because they didn't kind of let themselves get used to that again. BPC can be an amazing supplement, peptide supplement used to get patients off of PPIs, but it overall lowers inflammation, improves gut health. It works on the brain, the neurologic system to lower neuro inflammation, so inflammation in the nervous system. So we've had really, really good success with it, with helping patients maybe with dementia or multiple sclerosis, or my best case there that I can ever remember was early on when we started using it in a doctor friends of mine's mom who had rapid onset dementia, Alzheimer's disease type, and we put her on BPC orally, and she improved so much. Like, she had gotten to the point where she didn't remember her family members, and until her death, she was able to remember her family members. I'm not trying to say her dementia went away, but it improved, and it gave them another year or so of really good quality of life with their mother. She ended up having a stroke and passed away at like 85, but they had another good year with her because of something simple like BPC. But then it's also a musculoskeletal healer. It does a great job with like degenerative disease, arthritis. Like one of my employees' grandfathers, he's a rancher locally. He was having a difficulty gripping a square bale of hay, and throwing it. It wasn't the weight, it was the gripping of the bands. He just couldn't do it. And I'll never forget, he took it for 2 weeks and he showed back up and he was here to get more. And I'm like, hey, you shouldn't need any. What's going on? He goes, man, it works so good. My wife started taking it. So I come to get her a bottle. I don't like her taking my stuff. So it really can do, that musculoskeletal inflammation, neurologic inflammation, and gut inflammation. That's really what it does. And then we turn around and combined it with KPV, and KPV lowers gut inflammation specifically through a pathway, through a protein that we call nuclear factor kappa beta. Sounds like a sorority, but it causes gut inflammation, and we can lower nuclear factor kappa beta secretion in the gut with KPV. So you really have these two perfect peptides that you can put together that work very synergistically and have this symbiotic relationship to help with patients' overall gut health. And I'm going to go back to something else you said, which was really, really smart, and we didn't even plan it, was our brain and our gut, and neurotransmitters, specifically serotonin, the production starts in the gut. And so if you don't have good gut health, you don't have good gut serotonin production, which then turns into good brain production of serotonin. So you get these patients that feel more anxious and depressed. And that's why I said, an increase in anxiety can be a sign of poor gut health. So I'm not necessarily against antidepressants, but we need to be thinking more long term. Totally different subject. I ran into a psychiatry clinic providers this weekend that are actually now checking hormones on depression patients, anxiety patients. They're going into gut health with anxiety, depression patients. I'm like, my God, that is the most health forward psychiatric clinic I've ever heard of. And shout out to them. Good job, guys. I mean, that's amazing. You're not just trying to throw medicine or prescriptive antidepressants and anxiety medicines at people with those things, looking at other issues that could heal the problem, not just treat the problem.
Yeah, I think I have a stressful job, but I sleep pretty good, and I think that my attitude is more positive since I started taking these. You know how things kind of annoy you or bother you, and then you dwell on them for a while, and it kind of ruins your mood. I don't know. I just my experience has been, I believe it helps me to have a more positive outlook.
And I think it's a philosophy that we need to start having too. Like we have to start learning, like I can't, by the way, I'm a high stress guy. My wife, who you know well, would tell you I'm a glass half empty guy. She's a glass half full person. It's why we get along. But it's starting to change your person, not your personality, but your mindset too. Of like, hey, I can't let everything. If I'm going to run a business, I can't let every little thing that pops up be an ender. Just like I got to deal with it. I can't get pissed about everything because you and I both know. Heck, we work together. Shit happens, and maybe sometimes you get upset by those things, but sometimes you got to put it in that category of SA. Shit happens, and you just got to deal with it and move on. But as I tell patients, if we can figure out together how to get a good night's sleep, like everybody that's listening has had a bad night's sleep in their life, and your variance for dealing with things in a positive manner gets awfully small when we've had a bad night's sleep. If we start our day off with, I always say, with a good night's sleep and a good workout, there is great chances that no matter what gets thrown at you today, you're going to handle it with grace and ease. If we're tired, and that's why I'm a big advocate of sleep monitoring. That's why I like the Aura Ring, but I'm not trying to sell them. I have no financial contract with them. I just think that Aura Ring does a good job. But even sleep, back to inflammation. Inflammation drives poor sleep. Everything that we talk about, like there's so many things that all just come into this. It's like the spider web of things that all work together. But I think if patients would really just say, okay, like one of my good friends, Juan Batista, he did a post on Sunday night that I thought was amazing. And he was like, you can do all the peptides, all of the nutrition, you can do all of this stuff. All the peptides, all the hormones that you want to do. But if you don't start with the basics, get a good night's sleep, drink enough water, eat right, exercise properly. That's the basis of everything that we do. Then we layer on hormones, then we layer on peptides, then we layer on maybe some small molecules and things like that. Because one of the biggest things I struggle with as a provider, and I know other people do too, is like, wow, I have all these cool tools. Like I always say, it's like I grew up in a mechanic family. Okay. It's like going into a 30-year veteran mechanic Snap-on toolbox. They got a tool for freaking everything in there, but you don't use them all at once. And some things you only use once a year. It's how do you pull some of these basic techniques in to the masses? And we know that nutrition works for everybody. We know that exercise works for everybody. We know that hydration works for everybody. You can't convince me that we know that fasting works for 99% of everybody. These are all the things that we know that work for these patients to lower inflammation and all these sorts of things. Then we can mix on simple things like KPV, BPC, that really help. Now I got the person who's trying to eat better, do better, exercise better. Let's throw a little BPC, KPV in there. It's easy. It's not budget breaking. They can do it once a day. Then we can start layering these things on to really help our patients in the long run. So anyway, that was kind of long-winded, but it's just kind of my philosophy on how to help these patients.
Yeah, I think that you can't just, all right, I'm going to get a bottle of gut tides and everything will be okay. This is more, and I say it often, this is more, you have to commit to this. This is a lifestyle change. When you were mentioning about RFK talking about the food industry and what's wrong with it, I watched him talk about it, why he decided to make the move. But he talked about seed oils.
Mm-hmm.
Okay. And so, man, let's say I want to eat better and I learn about seed oils and how harmful they are. Well, brother, everything in our diet is impacted by seed oils. The American diet It's just amazing. Once you learn this, you can't avoid it almost.
Yeah, the only way right now you can avoid seed oils is if you cook everything for yourself. Otherwise, you can't avoid it. That's why there's a push, and I hope it does. That ultimately, if you're a restaurant and you use seed oils, you got to put it on the menu. Like, boom. That's the only way it's going to change is if people can go in there like, boom, canola oil. Like, nope, not eating it. And it's used, of course, in so many of it's used in all of the products damn near that we eat. That's in a bag or a box, right? Most, at least. And so, yeah, like patients are like, well, what's one simple thing I can do? And it's get seed oils out of your life. Of course, I always follow it up with, I don't know how you're going to do that.
Right.
All you can really do is start with what you cook at home. Luckily we're in Texas. That's why I always say, fire up the grill, man. Cook on the grill, stay away from the oils. I do, by the way, just out there, I love EVOO. Make sure it's a good quality EVOO. Make sure it's from Italy. That's another thing I always tell patients, just because it's got an Italian name on the bottle doesn't mean it's from Italy. A lot of those are from like Argentina. Make sure it's really Italian. That's where they make the best EVOs. They have very strict guidelines that they must manufacture under in Italy. You can literally take a shot of EVOO every day, and it's actually good for you. Like pretend it's Jose Cuervo or whatever, just take a shot of it. Those are good oils. Like I tell guys, if you want to saute a couple pork chops, not slathered in flour, just salt and pepper and put it in a skillet with some EVOO, I'm cool with that. I'm down with that. So it's just trying to change our thought processes. Yes, you do have to, spend money on nutrition. There is no such thing as cheap, good nutrition. So we have to spend money on it. But I'm going to go back to the analogy or the example I like to always tell my patients. We're in Texas, and I talk to these guys, and they love to spend money on their trucks. Nowadays, these freaking trucks are hopefully my wife's not listening right now. I've been looking at trucks online, not saying I'm going to buy one, but now like a really cool truck is 6 figures, man. $115,000, $125,000. I remember when I thought 55 was a lot of money for a really nice truck. And they'll take that $100,000 truck and spend another $20,000 on upgrades, like lift kits and all this stuff. And I go, but yet you gripe about, the bottle of olive oil, costing $14.99. Well, that's my point is we have to realize these days, again, we're not a political show, that everything's freaking expensive these days. And we just have to figure out where's the best way to spend our money. And I would not go today and go buy a Ford Raptor pickup, okay, for $120,000 and say, I'm not going to change the oil in it. I'm not going to rotate the tires. Screw that. That's a waste of money. But yet when it comes to buying good food for our bodies, that's going to, we can also look at it another way. If I could work another 5 years in an efficient manner and actually feel good and want to work 5 more years, well, that's 5 years of income that I added to my portfolio that I might not have had because of how I ate and drank and all those sorts of things. So anyway, the good news is most of my patients, I don't have to convince them that spending money on nutrition is a good thing, not a bad thing. But it's tough. It really is tough these days. Hopefully politically, some of these things do change it, no matter who wins with our food and that sort of thing. Maybe everybody will see the light. Unfortunately, lobbyists, if you don't think big pharma is completely connected to the food industry, you're crazy. They're actually owned by the same conglomerates. And so the food that makes you sick is owned by the medicine makers who give you the medicine for the conditions caused by the food. I don't know how we're ever going to fix that, but rant over. So anyway.
So, all right. So we've been listening, and let's say we want to get some of these gut tides. What's the best way? Hey, where should I go to get them, and how should I take them?
The easiest way for us is the easy to take orally once a day. I will say sometimes if we're in an acute setting, like, acute diarrhea, maybe we're on antibiotics, something like that we want to prevent gut problems, I'll say, hey, twice a day for a few days, then go back to once a day. But generally once a day, orally, easy to take. And we have our online store now. You obviously can come into our office. We always have it on the shelves. You're welcome to come in. In our office, we also sell just straight BPC. those are going to be more for arthritis patients. We generally like the BPC KPV combination because it does a little bit of everything. And that's the researchclinic.com. Click on the, I think it says store or shop or something like that. You think I would know that. I think it's pretty simple to figure out though. And you'll see Gutides is what we call our combination of BPC KPV.
Yeah, you know what? You don't think about it, but hardly ever do I get heartburn. I mean, it's rarely, but you know, when you don't have it, you don't think about it. But when you do have it, you go, oh my gosh, it's rare that I have heartburn. And
if I could, real quick, before we forget this thought,
Mhm.
heartburn is absolutely a sign of inflammation in your gut. Okay, you don't have a completely healthy gut and have heartburn. Okay, I just want to make that point that if you have heartburn, you have inflammation. And so if somebody's listening, like, yeah, I have a lot of heartburn, I guarantee you have inflammation. We don't even have to go any further. But you're right. Most of my patients who are on Gutides say, man, my heartburn went away, or I don't get heartburn much anymore. I used to be a high heartburn guy, but now that I do all these things, man, really only if I go eat some crazy wings or something, do I get heartburn, and that's pretty understandable.
Yeah, good stuff. It's a simple thing to take once a day. It's not a big deal, but it makes a big difference. And long term, it impacts so many things in your body that's so good for you.
Yeah. I always say, one last thing I'll say is if I always tell patients the great thing about Gutides is I believe that you will feel a difference within the first bottle, which is 30 capsules. So if you take it once a day, it's a 30-day supply. So the great news, I always say, don't feel the need to buy 2 months or 3 months at a time. Buy 1 month because you'll see the difference. It is rare to never that somebody buys 30 days and say, man, that made a big difference in my life. So again, gut issues, or you're on a weight loss program and you're not losing weight despite being on big doses of semaglutide or tirzepatide, stress is high. Those are all small indications for trying Gutides.
Yeah, making a big difference. It's a lifestyle change. And, Johnny David put here, the more protein I eat, the less heartburn experience he has.
Yeah, and everybody has their own experience with heartburn, right? And so, for me, it's fatty foods. If I eat really back when I was, smoke, like, dude, I love barbecue, but smoke how you go to a barbecue place and they're heavy smoke, man, as soon as I take that first bite, if it's heavy smoke, I just wasted whatever $30 in barbecue I just bought because I'm not eating it. Low smoke I can do. So smoke, from foods, really, really do it to me. And that's just lowering that lower esophageal sphincter tone, letting all that stuff come back up. So anyway.
Wow. All right, Dr. Kris, this is an excellent conversation. I had several likes and comments there. Go to theresearchclinic.com and go to the store there and get you a bottle of these Gutides and let us know. Let Dr. Kris know how did it work? Did you see a difference? And what other things maybe you should consider? But it's a great place to start.
Absolutely. Agree.
All right, I'm going to do the rollout here. Thanks for joining the Dr. Kris Podcast. If you learned something today and you want to connect and get more information, visit our website, www.drkris.life, where you can find more great information or even schedule a time to learn how you can engage with Dr. Kris. Be sure to follow, like, share, and we'll see you on the next episode of the Dr. Kris Podcast. Again, this summer, it seems like it doesn't sound like you're going to barbecue.
Yeah. Well, like I said, this weekend, we're going to go to A&M and watch Notre Dame and A&M for Labor Day and have a good time. But everybody out there, I hope they have a great holiday weekend.
All right. Take care. And we're signing.